talk about assessing quality of life in a shelter context. And I'm going to try not to geek out on you guys too much, because this is one of those topics where there's actually a lot of literature about it, but most of it is more research focused. And so a lot of these tools are well developed for research projects, but turns out to be not that practical to use in your daily life. So I'm trying to use those principles that are from the research world and talk about how you can use them just in your day-to-day, particularly to help make decisions about patient care. So be interested in your comments or questions or your ideas about how you could use some of these concepts. And I've tried to take out some of the really heavy literature-focused things from this talk, because otherwise it'll just be Margaret and I lost in the weeds of this, because I actually really, really love this topic. So what we're going to talk about today are general principles of how we assess subjective things. So subjective things are about feelings. Things that you know without talking about them, what makes it very hard to measure them, and it makes it hard to be scientific. How we can apply these things to our daily assessments of the animals in our care, and how we can use these observations to determine what's the right thing to do for animals. In shelter and animal welfare in general, we have a lot of dilemmas, right? Our ultimate goal is to prevent suffering. And as I learned in my last talk, not everyone always agrees on the right thing to do and what the best way to prevent suffering is. So we need to have some framework for these discussions, some basis for making the decisions. That's really what this topic is about. Some of the hot topics that I sort of threw up as things that come up a lot where quality of life really matters is our situation with dogs, right? So a lot of us do not euthanize dogs for space anymore, but we sometimes have dogs that we are faced with euthanizing because we don't feel that it's safe to place them in the community. And those are really hard discussions, and it's going to really depend on what resources you have in your organization, whether or not you can provide that animal with a good quality of life or not, especially if it's not able to be placed. So that's a really, really tough one, and I think that thinking about quality of life and talking about quality of life can help guide some of these decisions. It doesn't make the decisions any easier. It doesn't come up with what the solution is, but it can give us some of the words that we need to use to speak about this in a thoughtful way and according to our ethics. Capacity for care, we're always talking about that as the mother of all standards in shelter medicine and animal welfare, and that's another one where your ability to provide a good quality of life for animals is going to be limited by your own organization or your facility's capacity for care. So that's fundamental. Anytime we're moving into long-term housing, whether it's an animal that's just staying for extra time, or if you're in a hospice situation or a long-term sanctuary situation, that's when we really need to pay excruciating attention to quality of life. Because if we keep animals in confinement without attending to their basic needs, especially their behavioral and emotional needs, is when we start to see suffering. So how would we be able to measure that? Subjective assessments, things that we try to measure using this methodology are things like an animal's health or welfare, quality of life, pain and stress. So these are all subjective concepts. You know yourself when you're feeling any of these, but it's impossible to know for sure with 100% certainty what another individual feels about any of these things. Generally, in order to measure an affective state, particularly in an animal, this is going to require a subjective assessment by a human observer. So we are using information that we know about that animal or that species and how they are in their normal environment to make qualitative judgments about how they're doing. And this makes us really uncomfortable, especially those of us that are scientists. In science, there's this concept called positivism. Positivism is things that you can observe and know for sure in the natural world. So that would be something like heart rate. So if you came up and measured my heart rate right now, it's probably like 160, some unhealthy number for me because I'm up here talking to y'all. And that's because I have some stress. My adrenals are activated and I have a little stress and I'm talking quickly and my heart rate's up. That you can know for sure. But to really know how I feel, if I feel stressed or anxious, you have to ask me. You can observe, she's a little bit tense, she's a little bit talking fast and loud, but you don't know for sure if I'm stressed unless you ask me. So in science, we love what is observable and knowable. So one of the pitfalls you want to look out for if you're looking at assessments and thinking about using them, one thing you want to watch out for is, are they using a physiologic or a knowable parameter instead of qualitatively assessing the animal. The physiologic knowable parameters are part of it, but it's never as good as that understanding from that individual's perspective. So it's the heart rate or whatever physiological parameter you're going to pick is just one piece of data. So you want to be really careful. So you could never say like, that animal's all set because his heart rate is low. You don't really know. You just know that his heart rate is not high. If his heart rate is high, that might be a bad sign, but it's not as good as what they're telling you with everything summated. Does that kind of make sense? So in order to really know how an animal is doing, you need to be an expert with that animal in its environment in order to ensure the most accuracy. So fortunately, most of us are pretty good experts at knowing how the dogs and cats in our care are doing. So subjective states are feelings, okay? And these can be physical or emotional in origin, and they can be pleasant, so good things, or unpleasant. Unpleasant feelings tend to have a bigger impact on an individual's quality of life than pleasant feelings. So if you're sitting here and you had some of that lovely iced tea or that lovely lemonade at lunch and you couldn't quite figure out where the bathrooms are because they're quite far, you have to kind of walk quite a ways down the hall to get to them, you're going to be uncomfortable and increasingly uncomfortable the longer I battle at you. And even if you think this is the best talk ever, you're going to have a lot more trouble listening to me than if you've managed to find the restroom during lunch. So those negative feelings, no matter how positively disposed you are to anything, can be increasingly hard to overcome. And so you want to think about that when you think about animals with chronic pain or chronic dental pain or chronic arthritis pain. How much are those negative experiences impacting that animal's quality of life in ways that we maybe historically have underappreciated? So I'm an anesthesiologist, and I'm trained to assess pain and to make treatment decisions on my objective and subjective assessment of pain. So pain is the easiest way that I can talk to you guys about how you would measure these things, because I do this every day. So in people, we use visual analog score. So if you go into the hospital, and if some of you have probably been in the hospital and you've seen this, they tape it up right on the wall, and it has these little happy face, sad faces like here on the slide. And so I just say, patient, please put an X on the line as telling me if you have any pain, no pain, or hurts the worst. And in people, this is the most accurate way to assess pain that we have. It's the person verbally self-reporting how they feel. And so you can do this for animals as well. So myself as a trained observer, I can do a visual analog score on an animal, and I can assign them a score based on how they react to when I palpate their painful spots, my observation of their posture, their behavior, and I usually do throw in the physiologic parameters like their heart rate and respiratory rate and whatnot. So because I've been trained to do this and theoretically I'm good at it, my score should be predictive and repeatable and reliable. If I add a dynamic component to it, meaning I interact with the animal, I ask them to get up and walk, I palpate their incision, then it's called the DACVAA, so the dynamic visual analog score, and that's even more accurate. However, if I hand this little card to my student, which I'm going to be doing in a research project starting up in August, and I say, okay, student, go assess this patient, chances are my student is not going to be as good at scoring the patient as I, a trained individual. So you need to put time into training the individuals and then testing them over time to make sure that we're all scoring them the same. So the bottom line is that when you adapt an assessment system for use in your shelter, the most important thing is that everyone in the shelter is applying it consistently, and then you're going to get accurate predictive results. So for animals, we have evolved our pain assessment methodology. So we do, like I said, the same exact methods in people, except that we're assessing the animal's not self-reporting. And you do better if you know what you're looking for. So this is the Colorado Pain Score, which is available online, and they have it for dogs and for cats. I refer to it as like the sad kitty score, because at the bottom you have sort of the sad kitty lying there at the bottom. At the top you have the happy kitty. We're going for happy, perky kitties in the shelter, and they have this for dogs too. And you can give the animal a score from 0 to 4, and there's also what we call a numerical descriptive scale, because in each colored line, there's a description of what the cat may be doing in order to get that score, and for dogs too. So I recommend, if you're going to do pain scoring as part of daily rounds, that you use a system like this to ensure consistency that gives the evaluators categories that they're looking for and gives a common language within the shelter for folks to be able to do those assessments. And then, of course, we have just sort of things that we know or we think are signs of pain in the cat. So cats, of course, are big hiders. Anything going on in their life that they don't like, they're going to go away from you. Hunched posture or not a lot of movement is a sign of pain in the cat. Lots of interest in people or other pets or activities. We know that if they're not feeling well, they're not going to groom themselves, or maybe they're over-groom a painful area. And purring is a weird sign of pain in the cat. So a lot of times post-operatively, cats are purring, and people say, well, he's purring, he must be happy. Well, sometimes they purr because they're in pain. I think purring and tail wagging are probably the most frequently misinterpreted behavioral signs that animals do. So purring and tail wagging in dogs, purring in cats obviously, to me just mean that the animal's sort of engaged in an emotion. It doesn't really tell you what the emotion is, it just means that they're engaged with you. Crying, of course, it'd be nice if they all cried when they were painful, because usually we can interpret that pretty well. But we certainly see that, people bring their cats in for yowling, for like inflammatory bladder conditions and things like that. So it can be a sign. Painful cats can be quiet, but they can also purr. You really want to watch for crouched body position. So both of these cats have really abnormal body condition. Let's make this thing work. Ooh, hand-eye coordination. So this guy is a little bit hunched, and he's a little bit crouched, and he's got a very tense face. So I don't know if he's painful, but I know he's not a happy cat, and I'm a little concerned about his body language. This cat, now this actually happens to be a cat in upstate New York in August, and it's just really, really hot. So the cat is getting full length on the tile floor to cool itself down. But if I saw this cat in the clinic, I would be really, really concerned, because most cats don't give you that completely stretched body language in the hospital, because they're usually too defensive. So I'd be worried that something really bad is going on with this cat, and we need to check him out. For dogs, similar types of signs. If they're not eating, oftentimes we worry about that excessive grooming. Panting is like a very non-specific sign that could potentially mean they're in pain, slow to get up or lie down, or if they have a behavior change is often the most common clinical sign. So stress, similar to pain, it's another subjective construct. It's actually what I started out my career measuring before I did my anesthesia residency, was looking at stress in shelter cats. So again, cats, they like to hide. It's been shown that fake sleep, or pretending to be asleep, is a stress coping behavior for cats. Zoo cats do this. This is normal cat behavior, is how they kind of block you out. You can't see me. I can't see you. My eyes are closed. You can't see me. Destructive behavior, those cats that completely trash their cage in the shelter, that's a coping strategy thought to represent the fact that the cat does not have any control over his environment. And of course, like the aggression, so all those cats that we tend to label as potentially feral or unsocialized, it turns out that it's hard to determine whether those are actually just stressed cats or feral cats. There's very few things that they do that can point you one way or the other, especially when they're stressed, and that's a whole nother talk. And then dogs, one of the things that we see most commonly in shelters is activity level. So there tends to be two peaks of activity for stressed dogs: the dogs that are completely shut down and are not active at all, and then the dogs that are hyperactive, and those are ones that are jumping or circling or pacing. So both are abnormal. Both could potentially mean a welfare problem. Barking is another one. It's a normal behavior for dogs. They bark as a way to cope with their environment, so it could mean that they're stressed. So how do we define quality of life? Quality of life is like happiness. Like, you sort of know it when you experience it. One thing you have to watch out, especially with veterinarians, is that we tend to talk about health status. So health status is not the same thing as quality of life. It's possible to have to have poor health and have a good quality of life if you're dealing with your health problem, and vice versa as well. So you can be in perfect health but still have poor quality of life, like because you're stressed and people just walked down on your lecture. That can impact your quality of life. So it's very personal and subjective. So nobody can tell you, you just need to man up and have a good quality of life. Like, it's totally up to you. And that's what makes it such a powerful tool in assessing animal welfare, is if we can ask animals and listen to what they're telling us about their quality of life, we can figure out what matters to the animal, and we can make changes that are going to impact them for the positive. So in people, it's much easier. It's defined as the objective living conditions and your subjective satisfaction with them. And you consider the individual. In medicine, it's related to your health-related subjective well-being. And in humans, it's a very powerful tool for helping determine the objective of healthcare decisions, because especially when you get to the extremes of care, it's kind of that just because we can do something doesn't mean that we should. You got to experience the whole patient. So this concept of patient-centered care in human medicine has really come out of the quality of life assessment. So yes, we can give you these treatments and we can get to the bottom of your disease, but if you're suffering horribly the whole time, then we're really adversely affecting your quality of life. So that is now considered as far as overall patient comfort. This is a very long definition of quality of life for people according to the World Health Organization. I usually don't like to put so many words on a slide, but I think it's helpful. As it says, the perception of an individual's position in life in the context of the culture and value systems in which they live. And so my best example there is I have a friend who is from Salt Lake, and her mother was Mormon, and her mother refused to take pain medications for her entire life. But her mother would never have defined herself as suffering or having a poor quality of life. She just didn't religiously, she sort of religiously believed that this was her, Jesus or whoever telling her she needed to have pain. And that was her individual choice as a human with that religious belief. So that's allowed to be considered. Of course, dogs don't have religious beliefs, so we don't have to, it's not appropriate to consider that for dogs, but for people we do. You also get to consider their goals, their expectations, and all the way their personal beliefs, their psychological state, all the way that interacts to their environment makes up a person's quality of life. So it's complicated, right? It's complicated. How the heck are we gonna measure it? Like I said before, it's like defining happiness. It's subjective, it's broad, it's really hard to understand, and there's no universally accepted definition for animals. Here are some words that people use that sometimes mean the same as quality of life, so things like well-being, welfare, happiness, life satisfaction, contentment, peace of mind, emotional fulfillment. I don't really know whether my dog is emotionally fulfilled. I would hope that she is. And also, it varies from individual to individual. So some of us would think that this is a terrible thing to do, a poodle, but some of us would think this is perfectly fine. She maybe enjoys going to the beauty salon. So you have to look at the individual dog and how they react to it. One of the things that is really fundamental to welfare science is that welfare science implies responsibility for others. So I believe that as humans who control the systems and put animals into situations, it is our responsibility to maintain good welfare for those animals. Quality of life, as properly defined, focuses on the individual, not the group of animals. So you get to consider the animal's feelings, which is one of the reasons it makes it so difficult and one of the reasons a lot of scientists don't like it. But that's really boiling it down to what is important to the animal. And in that context, it's a very powerful tool because you can check all the boxes on your assessment. If I do these things, the cat should have good welfare, and you can still have a cat that is not thriving in that environment and has a poor quality of life. And if you only go through your engineering standards, have I met everything on my checklist, you're not gonna prevent that cat from suffering. So if you think about what's important to that individual animal, it gives you a lot of power in maintaining their quality of life. And in that sense, welfare becomes more than the absence of suffering. So you're moving beyond the minimum standard that you have to do, and you're trying to get to the optimum. What is the best we can do? What does the animal prefer? What does the animal like to do? More is not necessarily better. I tell my students this is the Chobani yogurt effect, so it's not the what, but the how that matters. That's quality of life. So there's lots of different ways that this is defined for animals. One of the most common, which will sound familiar to you because we use it all the time in animal welfare, is called objective list theory. And what objective list theory says is that optimal quality of life will result when certain conditions are met, i.e. your basic physical needs are met, you have normal physiologic function, you have social interaction, and you have minimal distress. And that's a great starting point, and it's fundamental to a lot of the assessments that we do. The problem with it is it neglects the individual preferences. So within that, you can have all those things checked off and still not have good quality of life. The most common example of objective list theory that you're probably familiar with is the 5 freedoms. In practical welfare, where you're looking at groups of animals, it's really difficult to consider how each animal feels. And so objective list is much more useful for coming up with minimum standards. Like this is what you must do fundamentally, as opposed to optimization, where you're going to allow more individual freedoms. And objective list theory is probably better for groups of animals. So this is a slide from the ASPCA defining the 5 freedoms for anyone who doesn't know. So you have the freedom from hunger and thirst, the freedom from discomfort, the freedom from pain, injury, or disease, the freedom to express normal behavior, freedom from fear and distress. So these 5 freedoms are the basis of everything we do in welfare, and these are the basis of our shelter guidelines. So you guys are all probably familiar with these because you know about the shelter guidelines, and you make sure that your facility matches up to them. So that's the easiest application to understand of the 5 freedoms to sheltered medicine is the ASV Guidelines for Standards of Care, and that helps us make sure that we're at least achieving the minimum that's required and the best as we try to give the best possible welfare. However, it's not addressing some of the specifics of individual animals. So some of the other frameworks, so I don't prefer one versus the other. The best way to assess quality of life is to include all these tools as you can. So another framework is looking at somebody's physical, mental, or natural state. And this one is useful because it's appealing to the public. So if you just think about where we are with farm animal welfare and what policy has traction with voters, people, the public, like the idea of natural states. So they don't like the idea of animals living in cages. They don't like the idea of confined hens. They like the idea of animals living where they think they're supposed to live, on a field, you know, with running free in the wild or whatever. So when somebody reacts to a cat in a cage or a dog in a cage, that's a natural state value system, and that's something that humans hold important, that we should be living in our natural state. Input assessment has to do with assessing external parameters. So the ASV guidelines fall into this framework as well. So again, what you put into your system. So that would be things like the size of your cage, the temperature in the room, what you feed. And then the really hard one is the affective. So the individual animal's positive and negative feelings. So a complete framework would include some of all of these. Once you regard animals as individuals, it raises your ethical stakes, because now you're thinking about that whole animal in a system, and then you have to start wondering, like, well, which animals do we give this consideration to? So in the shelter, we already do this. We already treat all of our animals as individuals, so for us, that doesn't really change too much, but for other groups of animals, you know, like think about laboratory mice. If you start thinking about your individual laboratory mice as deserving consideration of their affective states, your job gets a lot harder. So Frank McMillan has been one of the early thinkers about this, and he really boiled everything down to 2 domains. So he talks about quality of life for animals as being a spectrum of comfort and discomfort, and I really like his approach because it's very easy to understand and it's very easy to apply to an animal in front of you. So in people, we talk about the physical, psychological, and social functioning. McMillan talks about comfort, discomfort, and pleasure as being the most important things for animals. And we usually visualize it this way. So this is called the balance model for quality of life. And in this model, on the, let's see, it would be your left side, you put all the things for the animal that are good. So all the pleasant feelings, all the happy things. And then on the right side, you put all the bad things. And what this model says is that quality of life is optimized when you have a balance. Now, we kind of have it up against us because there's a lot more negative things on the list than positive things. But, you know, fortunately, most animals aren't having all these things at once. But you want to do is everything you can to minimize these things. So on here is pain, frustration, separation from the owner, any of the bad things. You want to try to balance that out. Control of the environment is a really important factor for animals. It's one of the challenges that we all deal with. Anytime you put an animal in a confined situation, you take away control. It's one of the reasons why it's so important to keep your routine consistent, because it gives the animal the illusion that there's some control. If you mess up the system, the animal has a hard time adjusting to that. So you want to keep these things balanced. So this approach is not scientifically validated. Dr. Slater and I can't use that in a study really, but it's really great because it's understandable. Anybody can understand this, and you understand that to maximize this dog's quality of life, do as best you can to go towards that pleasant side. So this is a dog that had a forelimb amputation at the teaching hospital, and so in general, you know, she has cancer. She had just had a big, super painful surgery, and you know, all of those things we can expect to adversely affect her quality of life. But the nurses have done an amazing job to try to bring that balance back, right? So they have given her 1,000 blankets. There's probably like 4 blankets here. She has her own pillow. She has a squeaky bumblebee, which, hey, how's her moth doing? Yeah, it's moved on. And she has a tasty meal, and then she also has a wound soaker catheter, so she has really good analgesia. So as much as we can do for her to bring her quality of life back up, even though she has cancer and a painful condition. Does that make sense? So you want to think about your animals in your care and what you can do to even the scale. Some major contributors are social relationships. So especially for animals that are social, being around animals that they're social with is really important to them. Mental stimulation. So we all know if they get bored in the shelter, that's not good for them. So that's why enrichment is so important, because it's such an important part of their mental health. Minimizing stress, but you need a little stress just to keep yourself on top of your game. And control. As the animal adapts to their situation, the values of these things will change. So quality of life is always a moving target. It's not like I can assess your quality of life today and then you're done. Like no matter what, you go forward the same. No, each day it's different. And also you can think about things like blindness. So if you wake up tomorrow and you're blind, that's obviously going to have a devastating effect on your quality of life. All of a sudden you can't drive, you can't do any of the things that you wanted to do, versus slow, gradual vision loss over time gives you time to prepare to make changes. I'm actually working with someone right now who has a genetic retinal condition in her family. So she's, you know, about 30, and she knows that by the time she's my age or a little older, she's probably going to be blind. So yes, that's adversely affecting her quality of life. She has a lot of mental distress and decisions to make about her job and her life, but on a day-to-day basis, she's still doing everything normally. It's much different than if she woke up tomorrow and was blind. Cognition is really interesting. So today, in 2019, we're learning a lot more about cognition and the way that animals think and the way that animals can potentially anticipate the future, and how much cognition and contributes to quality of life is unclear. So in people, it's huge, right? Like, so if you're put in an adverse situation, like you're in prison, or I always think about those journalists that are in prison in Iran, and they're sort of stuck there, like not really knowing when they're going to get out. I always think that maybe that's what some of our animals are going through. But the person, I heard a guy talking on the radio about kind of how he got through it, and he has a whole framework in his mind about kind of what he stands for and how this is important to his value system. And he came up with like games and things he was charting on the wall. So he used his cognitive abilities to cope with his situation. A, he can rationally understand why he's there, and B, he can come up with activities to keep himself active. And so in some ways, having the awareness of what's happening can actually make your quality of life worse. And in some ways, you can make it better because it helps you cope. So we haven't really investigated this at all in animals to know. And some scientists think that in animals, cognition has nothing to do with it. It's all just how they feel in the moment. But as we start to give higher thinking to more and more groups of animals, like sometimes people talk about octopus and squid and how they're really actually pretty highly cognitive. I think what we incorporate into quality of life and the considerations we decide we owe them as society are going to increase. So that's kind of just an interesting thing. So for health-related quality of life, this includes all the factors according to your health. And the reason why this is so important is that in sick people, this predicts survival time. So if you have a better quality of life and the same condition as somebody else with worse quality of life, you're going to live longer. And this is really important for us because animals with poor quality of life are more likely to be euthanized. So if we maintain good quality of life, then they will live longer just like humans will as well. So this can help us in research measure the success of our treatments. It can also help us when we're doing like clinical trials, like so animals that have cancer, not very common in the shelter setting, but in the teaching hospital, we have ethical considerations about when should we stop, because we never, any of us, want an animal to suffer. And if you use quality of life, you can catch suffering sooner than if you go to more of a natural endpoint of the disease. So this kind of gets into like why we should measure quality of life. So it can help us make decisions for individuals. It can measure health outcomes if we're doing treatment interventions. It's helpful for clinical trials. It's also useful in and of itself as an exercise. So one thing that's been shown is that the exercise of going through the inventory of quality of life for the assessor will raise awareness and encourage empathy. Because in order to assess an animal's quality of life, essentially what you have to do is put yourself in that animal's position and determine how you would feel about being in that situation, which sounds kind of hokey-pokey and taboo, and we used to sort of say the opposite, but that's literally how you would have empathy and understanding for the animals if you imagine yourself in that scenario. And by doing that, you suddenly see things that before you were ignoring. And that's been shown in farm animal, like for producers. If you get producers to assess their animals' quality of life, they will see welfare problems that they didn't see before. So we can use that tool in the shelter as well to encourage our staff and ourselves to do a better job of looking at the animals we care for them. And then we can use it in our welfare assessments. So just to kind of summarize, quality of life is subjective, it's emotional, it's individual, and relates to that individual's experience. So how the heck are you going to measure it? And I don't have time to go into too much of it, but there are ways that you can scientifically quantify subjective phenomenon. It's pretty difficult to do, and as I mentioned before, we tend to incorporate objective criteria, things that we can observe and measure for sure, like physical functioning, like activity, like signs of disease, like physiological data like heart rate, respiratory rate, appetite, social support, things that we can easily measure. But technically speaking, those are not as relevant to the animal's quality of life as the way they feel. They affect their feelings. This is my rescue dog, so he's kind of a freak show up on the table. He has a high degree of stress. So because mental states can be so hard to assess, information about external states are often added. And really, really important experiences, pain, happy things like jumping on the table, relationships and control, those get more weight because we know those are really, really important to animals. So in people, they use specific assessment questionnaires. Again, people are easier because you can ask them. They're very similar to the structured questionnaires that are used to assess pain. They involve both subjective and objective criteria. And then you call Margaret and you do statistics to generate scores and meaning from your system. And those are really difficult. Like people have their whole PhDs developing the scoring system. So it is one of our frustrations in animal welfare research is just you can't always find a good validated scoring system to use, so we make them up. But there are several that have been validated for animals in different situations, and I believe the ASPCA is sort of working on a more global health-related one that we can use in some of our research. So just because our patients can't talk to us, though, doesn't mean that we can't measure them. So our human colleagues also work on nonverbal patients all the time. So we have neonates and infants that obviously are nonverbal, but we also have severely disabled or severely ill patients, critically ill patients who can't speak. And so they will evaluate pain and quality of life in those patients by using some of the things that I talked about. But there's even like a neonatal pain scale based on like the grimacing of their face, and there's one for critically ill humans as well. So you have to rely on observers in order to rate and report pain and quality of life anytime you have a nonverbal patient like we do. So one of the things that's really interesting about this is who gets to be the person that does the evaluation. right? So there's some argument for having a sort of neutral observer, somebody who doesn't have a bias. But on the other hand, I said you have to know the animal really well to really know what's important to them. So bias in the evaluator is really important. So for example, it's really common in human studies of children that the parent and the child disagree about something like pain and quality of life, which you can imagine, right? No parent wants to think their child is in pain or suffering. So you can imagine it'd be really hard for the parent to necessarily have the same scores as what the child would say. So there's always a potential for bias in these kind of assessments. So depending on the situation, you got to identify the most appropriate proxy. So possibly our owners are going to be a good proxy because they know the animal really well. They know what they do on a daily basis. Or our shelter workers, our adoption floor staff, people that are working with the animals, but maybe they're not, maybe they're biased, maybe they're not objective about that dog because they're connected to it, and maybe they aren't seeing the changes on daily life. So you always want to keep that in mind as to whether or not there could be a bias. So we do the same thing. We have questionnaire-based assessments. They're subjective. We use a proxy, whether it be the owner or a staff member. And I think that's going to look differently for every situation, who the right proxy is. I'm going to share this quick assessment questionnaire that Frank McMillan does, which focuses on the animal's feelings. Not at all validated, but really useful. Oh, whoops, I guess I took it out. I can put it in the notes to show you. But basically, you ask yourself, you ask your animal, how willing would you be to live the life your animal is currently living? And he just kind of walks you through a series of 10 questions that ends up asking. So I use that for owners who are struggling with a euthanasia decision. Sometimes by going through and asking their questions, it says like, how happy was your dog today compared to how happy he was on his happiest day? How, of all the things your dog enjoys doing, how many does your dog currently do? And so having those kind of conversations can really help people make decisions. And we can use that in the shelter as well. Like of the things that we think are important to this animal, how many can they do? How many are they likely going to be able to do when we complete this treatment regimen or after we've accomplished the plan? So measuring quality of life in this way has welfare implications. We are considering the individual, and the individual then matters in our decision making. And so that means we don't have to make the same decision every time. I think we struggle with that a lot. Like we talk about the slippery slope, or if I do this for this one, what's going to happen to the next one? And that's one of the ways that quality of life is super powerful, because I'm making the best decision to prevent suffering in this situation with the resources I have at my organization that I possibly can. That doesn't mean that I have to make the same decision tomorrow for the next dog, because there may be some other factor, there may be some new program, there may be some new research project, there may be something that leads me to make a different decision, but because I'm thinking about that individual, I can go ahead and make the decision. So that's where I think it could be really, really helpful with internal discussions. We can raise awareness with our staff among what's happening to the animal, and it directs our focus to what's important to the animal and gives us a way to notice change over time. And then we can use it to compare groups, just keeping in mind that the individual is most important. When is this going to matter? So, if your length of stay is really short and your animals are staying not very long, it probably doesn't matter that this cat has a crappy quality of life because his cage is too small. Like, we all know that cage is too small. It's better than what we used to do in the past, but it's not big as the cat would probably want. But if it's Wednesday and he came in and he's getting adopted on Saturday, it probably doesn't matter that much. But if he's going to be there for 4 months, then we need to take that really seriously and get him into an appropriately sized enclosure. Sometimes we're doing group housing, or we have conditions that work for most animals, but we have a particular animal that's not doing well. Maybe the noise level is affecting that animal adversely. We can assess that animal and just make a decision to pull him or her out if they're not doing well. So it's that individual focus that makes it such a good tool. We're still not really solid on what's the best way to conduct an assessment. Is there a questionnaire that I'm going to give to the staff and have them do it every day? Who's the best proxy? Is it that dog caregiver who's really, really bonded to the dog? Or is it a neutral person who's just going to come in and go with what they observed today? And I think that could vary depending on different situations, and we need to do more research about that. It's also important for cruelty investigations, right? So thinking about the animal's quality of life and the chance that that animal has suffering is really powerful for a legal case. So it can help you sort of decide, like, is this cruelty or not? Well, this animal is suffering. It will help us identify animals who've been mistreated. So if we're looking at a situation that's kind of marginal and we're like, well, is this okay or not, and we're not really sure, we can certainly go through our checklist. Do they have their nutrition needs met? Do they have comfort? Do they have health? How is their behavior? We can use our 5 freedoms framework. And then we need to look at the animal individually and what signs of suffering, distress, emotional impact do we see for them. Anytime we have an animal who's getting kind of low marks on a welfare score, it's going to raise our suspicion for animal mistreatment. Maybe we have lack of resource situation. We need to get that pet owner some resources so they can make improvements. You know, think about animals coming in with severe matting. The animal is suffering. Their quality of life is impacted. So what tool do we need to do? Do we need to provide a free grooming? Do we need to provide some information sharing to the client so that they can take care of that? Or is that an animal that's in a situation that's unsafe for him or her and we need to get them out? So as we do these welfare assessments and we try to make decisions, individual animal quality of life is going to be really, really important. Having these models that focus on feelings are very helpful for us. It also shifts the focus away from this idea that we're going to prevent negative states into creating positive change. So if you're looking for those positive things like play, like signs of relaxed behavior, like signs of engagement or social interaction, that's going to tell us what we need to do to keep the animals happy. So that's where your enrichment program and your knowledge of behavior comes into play. So you're doing more than the minimum. You're doing the very best that you can with the resources you have for that animal, and it's going to be really different for each one. Anytime you put an animal in confinement, you have a risk for isolation distress, for loneliness, for them getting bored or frustrated, which leads to unmet physical and emotional needs, which is the definition of suffering. So when you think about your enrichment, I think this is actually a picture from Tompkins County. I think I took this on my last trip up here. So you want to tip the quality of life scale towards the positive side. You want to look for those positive emotions that help demonstrate good quality of life. So something like play is really interesting, right? So if an animal is able to play, it indicates that their primary needs are met. So if you're starving or you're so painful that all you can think about is your pain, or you're so uncomfortable that you can't get comfortable, you're unable to demonstrate play. So I'm not saying that if they're playing, they're fine, there's no other problem with them, but what I am saying is play is a really, really good sign. If an individual is able to direct resources to play, then that means they're doing pretty well. And the really cool thing is that in the future, because they're doing these like functional MRIs, so they can do these studies where they assess humans going through positive or negative emotions, and they can look at which areas of the brain light up. So in the future, we might be able to do these functional MRIs on dogs and cats in different situations and start to figure out, or other animals too, what is positive emotion look like for dogs and cats in their brain, which is super exciting. And there might be blood markers for some of these things that we'll be able to measure in the future as a way of assessing quality of life. How cool would that be? So our goal in the end is to prevent suffering. And yeah, I thought I was running behind, so I sped up and then I finished early. All right, you get an extra 5 minutes of your break. Yay.